We'll look at the shoulder disarticulation. Now, shoulder disarticulation is another type of amputation which is kind of like so much. Why I say so much is if I amputate your fingers, it gives you still have some little life. You understand? If I disarticulate your wrist, you still have some little life. Even at your elbow, you still have some little life. But if I cut your shoulder out, that whole part of the body is gone. Okay? So it's total removal of the shoulder. Is how will I put this? Amputation, but this type of amputation we can say is a radical. Okay, it's a radical type of amputation. So it's a type of a major. You can say radical or major. Radical and major is the same thing, you know. So it's a major upper limb amputation. The entire arm is surgically removed, and this is at the level of the shoulder joint. You understand? So everything out. So we'll talk about why we need to do this kind of things. You don't just go and start cutting somebody's arm for fun. There must be a reason where even if you are sued in the court, you can be able to defend yourself. So the person has a lot of tumor, and this tumor can spread to the arm, is on the arm. It can spread to the chest, complicate the respiratory system, and the person will die. You just have to cut the arm out so that what you preserve that place. There's a lot of trauma. The arm has been severely damaged. The tissues, you can't manage them. Okay, they will become necrotic, gangrenous, leading to sepsis. Okay, blood infection where bacteria they could track into the blood, causing infections. You cut it out. There's uncontrolled infections like gangrene and necrotizing fasciitis. You cut it out. Then also some congenital deformities where the arm is just there for fashion. The person can't use it for anything. You also, cut it out. Oh, I was thinking I could actually just flip over to the next page, but it's not possible. All right, fine. This is another picture. So surgical considerations, incision is designed to allow good tissue coverage of the stump. Blood vessels and nerves are carefully ligated because you don't want them to bleed so much. As I ligating, you are blocking, you understand? So muscle and skin closure. So rehabilitation afterward, you can give prosthesis, physical therapy, you know, psychological support, loved ones are around the person, telling the person that life hasn't ended, they can live a good life. You understand? Of course, I don't know. Sometimes when you do before you do the surgery, the patient is conscious. You can always advise, do all those counseling. But sometimes there's an accident, the patient is unconscious, and the person just wakes up and see that their arm is gone. Maybe they were a right-handed people. They didn't know how to use their left hand. So all of a sudden now their life is changing. They have to go back to childhood, learning how to use the hand. So that one is usually much more crazy.